Good afternoon, everyone. My name is Dr. Joanne Clinch. I am the Clinical Director in the Wake Forest University Student Health Service. I'd like to speak with you today about some of the important ways each of us can reduce the risk of COVID-19 transmission and protect our community. It is important for all of us to practice what I call the 3 Ws. The first W is for wait, or social distancing. You've likely heard that it is very important to keep a 6-foot distance between you and others. Why is this so important? Over the last 6 months, we've learned a lot about how this virus spreads. The most common way it spreads is through respiratory droplets that we breathe in when we're near someone who has COVID-19 and they talk, cough, or sneeze. When someone is speaking or coughing or laughing, it is hard for the virus to reach a distance more than 6 feet. So keeping this distance or further would help to protect you and those around you from becoming infected. This is especially important when we can't wear a face mask, like when we're eating or drinking. The second W is for wear, which means wearing a cloth face covering. People who are infected with this virus can spread the infection 1 to 2 days before they feel sick. And for some people, they may be contagious but never develop symptoms. That is why it is so important to wear a cloth face covering, because it keeps the virus particles in the mask and from escaping out into the air and infecting others. The third W is wash. Now, you've all heard it is very important to wash our hands frequently or use alcohol-based hand sanitizer. That is because the germs on our hands when we touch our face can cause infection. And it is really challenging to keep our hands away from our face. So washing your hands frequently would help to reduce the chance of becoming infected that way. Wake Forest is planning very carefully to create a learning and living environment that helps us to use all of these measures. There will be messaging and signs that remind us to keep our distance, to wear our cloth face coverings, and to wash our hands frequently. This year, more than ever, it is very important to stay home when you are feeling sick and to stay away from others. Even if your symptoms are very mild, it's very important to connect with a medical provider to determine whether or not your symptoms may be from COVID-19. The university will make this easier by providing all students, faculty, and staff with a daily symptom screening tool that will ask about those symptoms and provide a connection to a medical provider if you have symptoms. Rapid testing and identification of people with COVID-19 is essential in boxing this virus in and preventing the spread. For people who are determined to be sick with this infection, it is very important that we get them into isolation after we have tested for this virus. This can be challenging, so Wake Forest will be providing support for students to continued connection with their academics and other supports as needed during the time they're in isolation or quarantine. But it is very important in slowing the spread of infection to take those measures. I want to acknowledge just how challenging all of this is. This is not the college or life experience any of us expected. Following this guidance together, though, is our best chance to move forward until there is a vaccine against COVID-19.